to have you do on the table is first grasp. I'm going to have you just flex the arm so it's at 90 degrees. And then you're just going to grasp, palpate. You'll get a little of teres when you palpate here, but most of the muscle you grasp is latissimus. And then on the anterior side, I'm going to have you grasp for pectoralis major. So that kind of gives you your landmarks as far as what muscles you're working in between. And then when you work into the point, what you do is the easiest way to do is to slide your hand under the lats, and then you're going to take your thumb, like so. And you're not, see, if you just push straight in, you're going to miss the point, because you really have to come up and over latissimus to get to the center of the armpit. So what you're going to do is, see, you're going to roll up over the hill.
There's the hook.
Yep, and then come back down into the point. And so now I'm on heart 1. But if you just press straight in, you're going to be pressing into latissimus. So again, what you do is you come up and over and back down towards the head of the humerus. So that's the easy way to find the acupressure point. And as far as pictures go, there's no great pictures of this particular point that I've seen in the books. Then the next point that we're going to find, is it okay if I roll this up? Yeah, okay. Okay, so the next point we'll find is heart 3. And so when we find heart 3, when the client is supine, what you do is you'll just flex the arm like so. And then what you'll do is come to the transverse cubital crease on the medial side here. You'll just place your thumb. Don't apply pressure yet. And then what you'll do is you'll extend. You can relax your arm. Okay. You'll extend the client's arm, and then you just press right in. And you're pressing towards the medial epicondyle of the humerus here for this acupressure point. And again, you can kind of hook over and around. And this particular point is the C point of the heart channel, used for heart pain, heart palpitations. This point we use for tennis elbow or tendinitis of the medial epicondyle. And you can also use this point for poor memory. So that's the acupressure point, heart 3. Yeah.
Sorry.
So then the next point we have is heart 7. Heart 7 is pretty easy to find. What you do is what I'll have you do is just try to grasp for that tendon, the flexor carpi ulnaris, when you're working with your partner. And then all you have to do from there is just take your thumb and get on the radial side of that tendon. And then what you do is just press here, right in the, you press in between the articulation between the styloid process of the ulnar bone and the pisiform bone. And then you're just going to press down and angle upward for this particular point. Use this point for insomnia, heart palpitations, chest pain. I'll use this point for wrist pain as well. And distally, because it's a shoestring point, you can use it for aching and heaviness in the joints along the channel.
Is there a direction you're pressing?
Yep, the direction is sedate. Can you relax your elbow?
Yeah.
Okay. So the direction you press, usually in class I'll have you sedate the point. Okay, so that's a lot of times what we'll do in massage therapy when people are coming in with pain. Sedate, you'll press directly in 90 degrees, so I'm pressing straight down into the point, and then what I'm going to do is angle back and pull just slightly. If I wanted to tonify the point, it's a completely different feel. What I do is start just a little above where the apex of the point is, because I'm going to go 30 to 60 degrees with the direction of the flow. So I would start here, so one's here, flowing this way, so I'm going to press towards the pinky here. I would start a little distal to the point and then come in at like 30 degrees and push. And it's a completely different feel when you try to tonify a point than sedate a point. Usually when you tonify a point, it's more of a warming feeling, rather than a sedating point initially is going to be a little tender or painful, but most people would say it's good, good pain.
Yeah, it's good pain.
Yeah.
Like it's totally different.
What would make you decide to tonify rather than?
If someone's coming in.
Will you tonify me?
So just one generality. If someone comes in with acute condition, okay, first what you would do is you would sedate the point, So you're releasing the blocked chi where there's pain or there's an issue with the body, or there's chi and blood stagnation. So first you sedate and then you tonify. So you sedate it to clear the blockage, and then you tonify it to help increase energy, and then you would sedate one more time just to make sure that there's no blockage left. If someone has a chronic condition, what you want to do is first tonify it, because it's something that's chronic, that's, you know, more of like a, you know, when you have something acute, it's more like a sharp, like intense pain. Something chronic, it's a lot of times more dull. It kind of comes and goes. It's not always present. Pain scale is usually a little bit lower for people. What you would do is you tonify, so you try to, you know, bring energy through the point, or bring chi through the point, and then you sedate it, and then you tonify once again. But just in general, when people are coming in for massage therapy, usually you sedate for pain or chi and blood stagnation. But sometimes people come in and they'll say, you know, well, I might feel tired, I might have a problem with this, you know, stomach issues, I might have a problem with liver issues. Someone might say that they, you know, feel tired or they feel weak. In that sort of instance, you're going to want to try to tonify the points to increase the chi flow through the meridian to the internal organ. So most times with massage therapy, you probably end up sedating. But, you know, it's one of those things that over time you kind of learn what to do by using it as well. So